Welcome to Elevate. I'm Rachel, and this is Nikki.
Hi, Rachel.
We're here to bring you the best insights from local wellness experts, helping you elevate your health one simple step at a time.
Don't forget to sign up for our newsletter for curated wellness tips. You can watch this episode on YouTube or Spotify, or listen on Apple Podcast at Elevate Wellness.
On this episode of Elevate,
we look at the brain map, we look at the brain activity, we see those brain waves, we match it with the symptoms of what the person is telling us. We never treat data, we always treat the patient. So we see how the brain waves relate to what the patient is telling us. Sometimes a patient will come and say, I'm just really, really anxious and I can't stop being anxious. And then we'll look at their brain waves and it'll really show more of a depressive state. And then you say, well, let's talk about more why you're anxious. Well, I'm really, really tired and I'm really not motivated. And that makes me anxious because I can't get my work done. So really it's the depression that's causing the anxiety, believe it or not. So now we know what we have to do in the brain. We kind of have to wake that up a little bit, sharpen it up, speed it up a little bit with these therapies.
In this episode of Elevate, Laurie Sampollo, Clinical Director of Brain Performance Training, LLC, shares her journey from traditional nursing to neurotherapy, a path inspired by her own family struggles with addiction, anxiety, and PTSD. With more than 20 years of experience as a registered nurse, Laurie has seen firsthand how many patients struggle without the proper tools to manage their symptoms and how neurotherapy can create lasting transformation. The conversation explores the signs and symptoms of addiction, the impact on families, and the importance of recovery tools. Laurie emphasizes the role of neurotherapy in addressing mental health challenges, breaking the stigma around diagnoses, and supporting lifestyle changes that improve overall well-being. She also shares practical advice on hydration, community support, and the hope that comes from holistic approaches to healing. We learned so much from our conversation with Laurie. We hope you do as well.
Well, welcome, Laurie, an official welcome to Elevate. We're super, super happy to have you on today.
Thanks for having me. Mm-hmm.
Yes, thanks for joining us.
Absolutely.
Mental health is something that impacts many of us, individuals, families, whether it's anxiety or stress from trauma or addiction. And many feel stuck without the right resources, where to begin, or they feel held down by a stigma. And you've taken this powerful shift from traditional nursing to neurotherapy. Can you share with us what inspired your journey?
Yes, absolutely. I'd be happy to. So my husband and I, we've been married for almost 35 years. He is a first responder, paramedic, and has recently shifted into peer support, which focuses mostly on the mental health needs of that community, first responders. So he goes to conferences and lectures, and we were struggling at this time with one of our sons having a lot of trouble with addiction. It was a really tough time in our house. We don't even know how it happened, where it came from. He was struggling. And Stephen and my husband went to a conference, and it was led by Dr. Nelson at a place called FHE down in Florida. It's a behavioral and mental health facility that helps people with these problems. And he came home, he's like, I think I found something that's going to help our son. And it was not only all of the therapeutic things that go along with addiction treatment, but it was this neurotherapy that was offered at this facility by Nicholas Dogers, who is our mentor. So we sent him down, and he had a whole bunch of months of treatment, and he did really, really well. He's almost 4 years sober, and he's working, and he's doing beautifully. And we also learned that in that same facility, they have a separate area called Shatterproof, which is only for first responders and military people. So they can actually go down when they've hit their max and can't take any more. They can go down for a month and get all of these therapies, including neurotherapy. There's many other things that they do. So we really felt led to bring this here because we were like, these people are going. They're coming home. Some people can't always go and leave their families for a month or leave their jobs. So we really just wanted to bring it here because it's non-pharmaceutical, non-invasive, and highly effective.
You have a lot to unpack in your story, Laurie. That is just really the cliff notes to where you are today with offering this type of therapy. Would you mind walking us back a little bit to when the addiction started for your son, any signs, symptoms, and how it evolved, because your story is relatable
Yes,
to
ma'am.
so many people. They've gone through it. They maybe have not had the success that you've seen with your son. Praise
Mhm.
God that you have had
Mhm.
that and that
Mhm.
you have been able to get him on the right track.
Yes,
And
ma'am.
it's not
Mhm.
just children, it's
Mhm.
someone's mother, someone's brother, someone's sister, someone's dad, someone's mom. This is a disease that impacts families of all socioeconomic backgrounds and different members of their families. Talk to us from the beginning of how it started with your son, because that in itself could be something that could be life-saving for another
Mhm.
family. Catch those signs and symptoms early.
Yeah, I mean, we have three sons, and he's in the middle. So we had older and a younger. And, it's funny looking back. I don't know if there were actual signs and symptoms or if there were things that we were just ignoring. He had a lot of anxiety that he was kind of dealing with and masking. He had a really bad stomach. He had some irritable bowel problems, which really ties in with the anxiety also. He was functioning. He was in school. He was playing lacrosse. He was doing what he needed to do, but he did not like himself. He didn't like being in school. He couldn't sit still. There was an ADD factor. There were just a lot of things. And I didn't realize that he had started using. I kind of did, but then I kind of didn't. And all of a sudden it was just um, kind of blown out of proportion. And he was really just using every day
What was
to
he using, just
he
for
was started with marijuana. He went to alcohol, and then he went to a drug called Xanax, which I'm sure you've all heard about. I'm very thankful that he never did heroin or meth or any of those. I mean, they're all serious if you take too much of them. They really are. But he took those medicines and he felt better.
because
Everybody
it
that
lessened the anxiety. He didn't
yeah,
feel it anymore. Yeah, makes
everyone that
sense.
does this is masking something. So I listened to Matthew Perry's book. It was very interesting. I'm always interested in how addicts explain their whole story. And one of the things he said was when he first drank, he was a young teenager. Him and his buddies got some alcohol. And the way he felt when he drank, he said, wow, this is how normal people feel.
Mm.
Wow.
So it's something inside that like when you ask my son, how long have you felt like this? You say, well, I can't remember a time when I was younger that I didn't feel anxious. I
Mm.
didn't feel, kind of bad about myself or just not good enough. I don't know. I don't know. So yeah, the signs came quickly because then we were smelling and seeing how he was behaving. At first, we just dropped him off somewhere because we were like, you have to get help. You're in a place where you're not managing this and you're not functioning as a human. And he came back and he had a few different bouts with rehab, maybe over a year or so before he went down to Florida and then
Which
actually.
is not uncommon. People think, oh, just go to rehab and you'll be better. But it's usually multiple times of
Yes.
going back and trying to get on track.
And unfortunately, we sent him, he went to a place in Greenwood, South Carolina, and he did really well there. It was the first time he really went away for 4 months. He was there, and one of his friends was there with him. And unfortunately, he passed away when they came back. Because what addicts will sometimes do is they come home and they drink or smoke or take whatever they were taking when they were active. And plus, today, we don't know what's in a lot of the things that are out there. I mean, it's very different than it used to be, and there's a lot of heavy doses of fentanyl out there. There's heavy doses of lots of different things that they put in. They just put in poisons and toxins. They don't really care. They
They
just
don't
want you to
care.
want more. So you can overdose without trying. That's for sure. And I believe that's what happened to his friend.
And
But
I've
it's
heard that same story happen to
mhm,
families that have had someone with addiction.
mhm.
I've heard that story way too often, which is
Yes,
tragic,
it
tragic.
is tragic. Unfortunately, Matt, our son has lost a lot of people that he knew through his rehabilitation journey, especially those that do some of the, and I say like harder drugs like the heroin and the meth, because they will come out of rehab and just start right up where they left off. And their bodies are just,
Yeah. It just
we
takes
don't
that
know.
one time.
Yeah. And it's heartbreaking. And it is true that it's everywhere. It's every age and it's everywhere. We have patients at the hospital. I still work at the hospital, and we have patients that come in with alcohol problems that are in their 50s, 60s, 70s. It's very sad because there is an underlying reason they're doing this,
Of course.
usually. My dad was an alcoholic,
Mm.
and not until my later years did I realize that he had such high anxiety, social anxiety. You'd never know it when
Mm.
you met him. He was covering that. He was medicating it. He was masking it.
Yeah.
alcohol. And of course, you're talking about someone that would have been like 80 something now. So back then it wasn't alcoholism. It was just cool.
Right. Yeah.
Mhm.
Yeah.
Mhm. Yeah.
So your son, in his journey,
Hmm.
he goes to rehab a couple of times, and then what?
He went to Florida and he went through this program at FHE and did beautifully there. He got the treatments, all the treatments that they offer, which is, talk therapy, STEM that we do here. The difference with this therapy, though, is this will actually get to the root cause of some of the neuronal symptoms that you're having.
Interesting.
There's medicines that you can take that help regulate the hormones and the different things. Talk therapy is wonderful. There's different things like EMDR that you do while you're
Mhm.
talking and having
Mhm.
therapy. And he had all of those things, including massage and group therapy, like just a whole, they really do encompass a lot, even physical exercise, just so many good things. And he went to kind of they have like a step down kind of a program. So from there, he went to what they call it, you've heard like a halfway house or a sober living house.
Mhm.
So he went to a place like that and he literally started from ground zero. He had no car, no, he wasn't, you have to start with the bare minimum. So he was allowed to borrow someone's bike. He got a job. He rode to his job every morning at like 5 a.m. He did that for about a month. Then he got like a scooter and then he got a car. There was a buddy system where he couldn't walk to the corner store without a friend because you have to start to gain that trust and that accountability that you're not going to try to use again or try to figure out a way to use again. And honestly, just God took this from him. And he led us to this path of this therapy because he is fine. I don't even worry about him drinking or where are you going or what are you doing. It's not in his wheelhouse anymore.
Wow.
He knows that this is gone from his life, and he also knows that he has an addictive personality. That when he does do something, he wants to do it, full
Mhm.
blown. He wants to do it
Mhm.
all, and so he knows if he has one drink, he's going to want 12 drinks. So it's just not
Right.
an option for him.
Right.
And honestly, in the last 4 years, we've been to so many family things, weddings, engagement parties, parties, whatever. Everybody's drinking, doing whatever. He's fine. He just knows it's not for him and it's not good for him.
Wow, that is amazing because
That
you don't
is.
always hear that. You don't
And he
hear,
was young. He was like 23 when this all was really at the height of it all. He just turned 27 yesterday. So for
Yeah.
someone in that age group to really get through recovery is also miraculous because, the social life of that age group is everyone's going out and everyone's partying and,
Yeah.
for the most part.
Yeah. And
Hmm.
he can't just take that one drink. Some
Mm-mm.
people, you know,
Right.
it really is an addiction, and so much of
Hmm.
it is in your DNA. And I'm
Yes.
curious to know, though, you said he was covering up the anxiety and all of that. How is he handling those symptoms, or does he not have them anymore thanks to this therapy? I mean, it seems like anxiety can kind of come and go and creep in our lives
Yes.
during stressful situations. I mean,
Hmm.
I've dealt with anxiety. It fluctuates, it ebbs
Yes,
and
it
flows,
does.
it comes and goes. So, what
Hmm.
has been his experience there?
Well, with all the therapies that he had, including this neurotherapy that we offer, and he's gotten the tools to deal with the anxiety. He's
Perfect.
gotten the tools. He knows what to do. He knows to breathe. He knows to count. He knows to take a step back and give it a few minutes. He used to be very angry all the time, and that's not the case anymore. His stomach was a huge, huge problem. And believe it or not, some people don't realize that when you smoke marijuana or take it, however, it really can exacerbate the cells in your GI tract and make those things worse, make all of your stomach problems worse. And everybody thinks, oh, you smoke a joint, you get relaxed and it'll calm everything down. But when you smoke like he smoked every day, it actually excites those nerve cells in the stomach and makes your stomach even worse. So we took him to a GI doctor and he was like, "Are you still smoking?" And he said, "Yes." He said, "Come back when you stop because a lot of your symptoms will dissipate." And he still has some issues with his stomach here and there if he doesn't eat the right foods, and he knows what triggers it. But it's not like it was every single day, just kind of waking up with problems for no reason.
Yeah.
So we see it a lot in the hospital as well. Vomiting from folks that just smoke way too much marijuana. We have some nerve cells in our gut, believe it or not, and it has the opposite effect on your. It really just excites that and makes them overactive. It's
Wow.
interesting.
It
Yeah,
is very.
it's very interesting. And of course, that's not something I knew about until I had to know about it.
Right.
Our kids
Laura,
were raised. Go ahead.
You see this in the hospital still,
We do.
quite a few, from anxiety and the
Hmm.
addiction, and you see individuals, patients coming in as a result of not having the right tools
Hmm.
to handle things in a healthy way. Can you talk about the tools, good tools for handling
Yeah.
anxiety and
You
stress
know,
so we don't end up using things and abusing things?
I do help my patients. It's unfortunate. Recently, we've seen a rise in folks that are coming in with alcohol withdrawal. And I get usually like 6 patients to take care of. And it's not unlikely that I have at least one every time I go to work, which is a pretty high percentage, I think. I don't feel like that was always the case. But the tools are, it seems really obvious, but it's obviously not using, of course, which is how they cope. That's their tool. But a healthy lifestyle, eating the right foods, drinking enough water, getting enough sleep, getting some therapy, talking about it, meditating in some way, prayerful or otherwise, whatever you works for you. It's those things that reducing the stress in your life and learning how to deal with the stress in your life. And therapists can teach you these tools, whether it's stepping back and counting to 10, if you're a person that goes from like 0 to 60. But these therapies that we offer can help get those people kind of unstuck. So we talk about first responders being in a hyper vigilant state. They go to a public event and they are looking around. They're like, where's the exit? What's about to happen? They can't help it. That's what they're trained to do, and that's what they do for a living. But after so many years of doing it and seeing such tragic events, we can see that in the brain waves. So we will put a cap on and get an EEG, and we'll see the brain waves that are dysregulated. So for a quick little background of brain waves, when we're sleeping, we have delta brainwaves, which are nice and slow, and you can picture just a nice relaxing waveform. When we're working and we're paying attention, or in school, we have a very quick and fast, sharp brainwave form. When we see those brainwaves when we're not supposed to see them, is when we know we have a dysregulation of sorts. So we can treat those brainwaves and then treat some of this, and that will help to reduce some of the symptoms, if not all. Actually, anxiety and depression, things like that, and that hypervigilance is what we call low-hanging fruit in this field because it really responds beautifully. So I think it's all encompassing of everything. It's kind of like I kind of relate it to going to the gym. You want to get healthy, you want to go to the gym and start exercising. You're not going to stop at fast food on the way home. You're not going to not drink enough water and just drink energy drinks all day. You have to really do the whole picture. And I think that's what would help. The addiction part of it is really hard because there can be some DNA, but the tools, you have to go search for them in the therapies that are offered because there is help. And I think talk therapy is huge because getting to the reason, well, some people might not even realize why they're drinking or
That's
using.
something that you shared earlier, is that you get to the root cause. So can we just go over what exactly is neurotherapy? How does it work?
Like I said, the root cause. So if you have a traumatic brain injury and it's in the part of your head, and we do an EEG, we might see delta brain activity while you're wide awake during the day in that spot where the brain was injured. The brain is producing that delta wave activity to slow down the brain and let it heal in that spot. It's like protecting it. Meanwhile, that brain part should be showing beta or, something higher because you're up and you're functioning. So that's how we get to the root of the problem. We'll find that spot, and that's just an example, of course, but we'll find that spot and we'll try to help it regenerate by adding neurostimulation in different form. We have photobiomodulation, which is light therapy. We have pulsed electromagnetic field therapy. All of these different things are going to increase nitric oxide. We're going to increase ATP production, which is the powerhouse and the energy of the cell. It's rejuvenative. It's helping to change those brain waves to a higher functioning or a lower functioning, whatever it needs. So if we see the beta and it's called like an anxiety pattern, we'll slow that down. If it's a slower pattern and it's depressed, we'll want to speed that up.
How
So
do you
that's
do that though? How do you speed something up or slow it down? Is it through help me up?
yes, of
Help
course.
me a little bit because
Of
this is
course.
it's just fascinating and it's a truly a holistic approach
Absolutely.
to a serious issue and
Hmm.
what you're doing is literally life changing.
It's Rachel here. I want to pause our conversation to talk a little bit about something, or I should say someone pretty special. We're so grateful for our local wellness expert and sponsor, Dr. Sarah Salander, owner of Balanced Physical Therapy and Wellness right here in Myrtle Beach. Sarah is a women's health and orthopedic physical therapist who helps active women, especially moms, feel strong, confident, and capable in their bodies again. She knows that just because something is common doesn't mean it's normal. Whether it's leaking, pressure, or back or hip pain, or feeling disconnected from your body, there are real practical solutions that fit real life. At Balanced Physical Therapy and Wellness, Sarah takes a whole person approach, combining physical therapy, strength training, education, and lifestyle guidance so women can get back to the activities they love without fear or pain. Listen, this is a concierge physical therapy practice. She offers the highest quality, personalized one-on-one visits and progressive care designed to meet each woman's individual goals and lifestyle. Exclusive for Elevate listeners, get access to a free downloadable for a 10-minute body readiness check. It's available in our newsletter. Sarah will guide you through how to assess your core, your strength, and movement, and help you discover your next best step toward feeling strong and confident in your body again. Balanced Physical Therapy and Wellness is helping active women move better, feel better, and live healthier across every season of life. So visit the show notes to connect with Balanced Physical Therapy and Wellness and start feeling at home in your body again.
Elevate is all about connecting you with the best local wellness experts, and we couldn't do it without our amazing sponsors like Laser Lab. If you've been curious about red light therapy, this is your sign to finally give it a try. Laser Lab helps your body do what it's naturally designed to do: heal, restore, and recover using the power of light. Whether you're dealing with inflammation, slow recovery, chronic pain, or just low energy, red light therapy supports your body from the inside out. And here's the best part. For our Elevate listeners only, Laser Lab is offering an Experience the Light consultation. Your first session is free when you mention Elevate or use the code PODLIGHT at booking. Visit laserlab.com/podcast or stop by Laser Lab in person and tell them you heard about them on Elevate. Your body will thank you. So tell me how you slow the brain waves down or speed them up to get them really what I hear you saying is back on track where they should be in life. Okay.
Yes. So let me background that a little bit with Dr. Nicholas Dogres, who is our mentor. He invented all of these machines and this whole process. 22 years ago, his son was born with a hypoxic brain injury, which means his brain did not get enough oxygen. He was born blue for a very, and it was pretty intense. They said that he wasn't going to be able to function. They said he would probably need full-time care for the rest of his life. Being a neuroscientist that he is, he was like, I know I can regenerate his brain, but how can I treat an infant? How can I do it? So he partnered with somebody that God put in his path to make this equipment and start. He started his son with some lens therapy, which is low energy neurostimulation. So picture a little bit of electricity on the scalp, which is exactly what we do. And it's targeting those areas. And so he was able to rejuvenate his son's brain. And his son is now a 22-year-old functioning, working, living in an apartment, human. And he really, if you go to his website, Neurotherapy, you'll see the whole story. It's a wonderful story. Him and his wife, Tiff Thompson, he tells all about it. And he wasn't planning on doing this and bringing it out to the world. He's like, I just want to help my son. Mm-hmm. But his partner was like, you have an ethical obligation to put this out there because you could help so many people. So that was probably 20 or so years ago. And so what we do is we look at the brain map, we look at the brain activity, we see those brain waves, we match it with the symptoms of what the person is telling us. We never treat data, we always treat the patient. So we see how the brain waves relate to what the patient is telling us. Sometimes a patient will come and say, I'm just really, really anxious and I can't stop being anxious. And then we'll look at their brain waves and it'll really show more of a depressive state. And then you say, well, let's talk about more why you're anxious. Well, I'm really, really tired and I'm really not motivated. And that makes me anxious because I can't get my work done. So really it's the depression that's causing the anxiety, believe it or not. So now we know what we have to do in the brain. We kind of have to, wake that up a little bit, sharpen it up, speed it up a little bit with these therapies. So we literally attach a little bit of paste, a little electrode to the certain parts of the head once we see where we need to treat. And we collaborate with Dr. Dogres for these protocols. And we run a program through these machines that will give you a light stimulation. We put lights in at the same time. We put the coils on at the same time, which is all working together, all the different modalities to literally sharpen that brain up and get it back on track, like you said. And it also gets it into a cohesive state where the parts of the brain can actually talk to each other better, because sometimes they're just not communicating with each other.
This is
Fascinating.
fascinating.
Fascinating that we are just now. Why are we not hearing more about this rather than the traditional therapies and rehabs that people have had no success in going to over and over and over again? But, we are full of energy. We are energy. So it makes perfect sense that really putting energy into different areas of your brain with other modalities in the holistic arena could help.
Yes.
Give someone new life.
It's so simple, right? Like, it seems like such a simple concept, but
No
like
pun
I would have
intended,
never
but
learned
it's like a no-brainer, right?
No pun
No pun
intended.
intended.
No pun intended on that one. Yeah. Does seem like
Wow.
we learned about it. We felt just truly blessed to just learn about it and know that it could help our son. Because obviously he had some dysregulations in his brain, my husband and I have been married, like I said, for 35 years. We have a very stable home environment. I mean, it can happen to anyone. There wasn't any cause. And I think that even makes it more powerful, because there wasn't like any major life moments that like would bring him up to like say, let me just start using so I can avoid this. So I think that's even more powerful, honestly.
Yeah. I, you emphasize the importance of removing the stigma of mental health diagnoses. Can
Yeah.
you kind of talk a little bit about why you think that we still have those?
Well, unfortunately, it's people just feel bad saying, they feel like they're looked down on, and we're just trying to change that. We, especially in the first responder world, when they are these, big tough men, and they're going into the fires, and they're, just supposed to be strong. And it's not that you're not strong. We are humans, and we all, especially the things that they see and have to encounter and have to deal with. It's really, really hard. We've partnered with a non-for-profit. It's called South Carolina Mental Health for Heroes, and we get donations throughout the year. It's only about a year old, so we're new. But with that non-for-profit, we're able to get scholarships for first responders, military, active military veterans, that they can come and get this treatment for a fraction of the cost, because we really want to give this away. I mean, we really do. It would help. It helps so many people. We've had so many people that come to us and are now speaking about it, saying, my life has changed. I got my husband back. He wasn't even smiling, and his whole posture has changed, and we go do things together now. And I have such a different outlook, and I want to go explore the world because I'm not depressed. And we could see it in our patients. I mean, we could see it. And the good news is, regarding the stigma, is that they're posting online. They're telling other people about it. They're saying, go see Laurie or go get some kind of therapy, because this really has changed our life. We just took care of a younger woman, probably in her 20s. She had anxiety, and she did really well with the treatment. I haven't really heard back from her, which is fine. But her husband just actually texted me and said, how can I donate to your cause? I can only assume it's because he's seeing a difference in his wife and a difference in their life together. Reducing the stigma, I feel like, is just talking about it, telling stories, I'm happy to tell my story. And I spoke with my son and I said, I'm going to be talking about your story. And he's like, tell the world. He's happy to tell it. He wears it on his sleeve because he wants to be able to help people and know that there's a way out. And the only way to talk about it, the only way to get that stigma broken is to talk about it and say, look, this could happen to anyone. Nobody's planning on waking up and saying, I want to be addicted today to any substance. Nobody. And it really just kind of creeps in. And then all of a sudden it's really big, and it's a big mountain to climb. So I think just talking about it and getting the word out there, and especially with the first responders, is a big part of our community right now. It's okay. And it's funny because at some points in time, we'll have a couple at a time, and they'll be passing each other in the hall, and they'll be like, you're doing great. And they'll support each other. And it's really wonderful, because now it's like, oh, wow, I can go get help without people saying, you're a wimp.
Yeah, you're weak. I hate the fact that we want certain people, well, and everyone in general, but especially our first responders,
Mhm.
firefighters, law enforcement, military. You have to be brave and you have to be strong and you can't be weak and all of that. But
Right.
when you suppress yourself to just feeling one way, that's dangerous.
Mhm.
And you need to be able to have the feelings, and you need to be able to learn how to cope with these
Mhm.
tragic events that you witness almost daily.
Oh, yes.
Being in local news and seeing the things from that perspective, it's hard. And
Mhm.
we had such great relationships and friendships with people in that arena. And I can only imagine what it's like to show up to these events on a daily basis.
A lot
Personal
of
things that have happened in my family where these incidents have played a major role in the downfall of addiction and things like that. And we have to be willing to say to them, it's okay for you to come somewhere and be
Mhm.
able to get the help that you need. That doesn't make you any less of a person,
Right.
it doesn't make you weak. In fact, it makes you stronger for wanting to come and make sure you take care of yourself so you can be your best self, for your family, and for your community when you are true public servant. So
Mhm.
we have to break this stigma that's attached to you're weak if you don't get help or if you feel a certain way,
Mhm.
because we're not doing people any justice by trying to
Mhm.
put them in this one box of this is how you have to be. We
Right.
have to let you say, we're here to help you and heal you as you
Mhm.
help others. It's
They're
not right.
humans.
So we have to change it. And you're
They're
doing that.
humans.
Thank
They
God.
have children, they have wives, they have families, they have mothers and fathers. One thing with my husband and I, we always said our patients are just like our family. So we would treat them as if they were our mother, father, brother, sister, whatever, because we would expect that from anyone else as well. These people are humans first, and they are someone's mother, someone's father, someone's sister, someone's son. And when you get to a tragedy where a young person has a fatal accident, or honestly, this is a very small community. A lot of the times it could be someone you know, and
Yeah.
it's really, really difficult. So my husband steps in with that. He does what is the word I'm thinking of? He goes in and does like a decompression. I can't think of the word, but they'll call him and say, station so and so has had this call. I need you to go and talk with them. He's been trained with peer support and mental health. He went through a chaplaincy program, so he has a calling to do that. And he goes and has like the word will
Like
come to me.
kind of like counseling, but
Yeah.
not intervention. I know what you're trying to say though.
Yeah.
Yeah.
And just to get the guys to talk about it and realize, like you did everything you could. Let's talk through the situation. This is what happened. Sometimes it couldn't be prevented, or
Right.
it's just, so it's hard. It is hard. And these are big burly men, that, like I said, we've got to remove that stigma so that they can
Hmm.
come get help. And I think we are.
And I
Well,
think we said earlier, just to clarify for our listeners, your husband is a firefighter. And
Yes.
so that's the connection with his
Hmm.
line
Hmm.
of work. So how he's
He's,
helping others there.
oh yeah, firefighter, paramedic. He went through flight school. He was a flight paramedic, and he's got a lot of good training under his belt, and he's a big resource for that community. He really, really is.
It's
His
awesome.
his phone really doesn't turn off.
Usually doesn't in that line of
Yeah,
work.
yeah, but
It's
he feels,
always beeping, calling, somebody saying
Mhm.
something to you.
But he really does feel called to do it. So he's happy to do God's work in that respect. He really is.
Well, and the family unit is everything. When you see an individual outside of your own family or someone in your family that is
Mhm.
struggling, and we all need help in different capacity. Like we're relational, we're created that way. We need to
Mhm.
talk about things, and it's okay to need help. We're not supposed to be self reliant. We're all faith based women here. We rely on Christ
Mhm.
first. I could not make it through this life with
Mhm.
relying on my own strength. So there is much strength in acknowledging the weaknesses that we have, but also in the help that is available to us so we can strengthen our family unit too.
You've heard it takes a
Lori,
village.
Takes a village, yeah.
it
Yes.
does. It takes a
As I
village.
say, we're tribal, we're
Mhm.
tribal people in general.
Mhm.
So we lean into each other.
For everyone that's listening, I want to create a clear picture of who can come see you for help. If
Mhm.
it's for them personally or the family or friends that they have, what is it that a trigger word. If I have anxiety, if I'm dealing with depression, what are the things that people are struggling with that they could come and see you for help?
We can help pretty much anyone. The only thing that really is contraindicated is if a person has epileptiform activity or seizures. Obviously, that makes sense. We don't want to put electricity where we could stimulate a seizure. So we've treated young people, 8 years old. A young boy was feeling like he didn't belong. He was feeling like he didn't fit in school. He was feeling like we would all be better off without him. And so we ran an EEG and we helped him, and he's doing much better. We've helped a 3-year-old boy. He had a brain injury as well. He fell into a pool, and his treatment will be for years, but we've done a few trial treatments to see how his brain would tolerate it, but he's awake and alert, but he can't move intentionally. But he has shown massive improvements with this therapy. So much so that his mom is thinking of getting the equipment to have at her home.
Oh, wow.
So that she can just do it on a regular basis with him, because he will need years of treatment. All ages. And as far as the conditions and the symptoms, anxiety, depression, OCD, which is that obsessive compulsive, addiction. What else? We can deal with memory loss.
Really?
Yes. Depending on how much of the brain is affected. Traumatic brain injury, like I spoke to before, that part of the brain kind of slows down to protect itself and heal and get like restorative. But once it's through like a certain healing point, we can kind of, wake it back up again. PTSD, addiction, anxiety, depression, OCD, ADD, and ADHD as well, things like that. But I do have to say that there's a big component with these treatments, and we need buy-in from our patients. We need them to, when I have a consultation with someone, we talk about every part of their life, their sleep habits, their drinking habits, and their food. So a little story about Dr. Dogris. He had a family come in that was looking for treatment for their son, and they came in after hours, I guess after school, and they grabbed, came in with a couple of bags of fast food, and they sat and talked with the doctor and said, this is our son and he's off the wall, and can you please help him and whatever. And he said, let me ask you this. Do you eat like this every day? And she said, yep, we pretty much do. We're always on the road, or, running with work and school and sports, and we grab food all the time. And he said, well, come back in 30 days when you change your diet and you change your son's intake, and we'll see what's going on. And that boy did not need treatment after they changed his diet.
I just got goosebumps.
Yeah. And I can tell you that would put me out of business, and that's fine. I would love to be out of business. I would love people not to have these problems. But honestly, the food additives, you've been hearing a lot about seed oils, the food dyes.
The red dyes, yeah.
All of the things that are in our foods are just creating inflammation. They're creating hyperactivity, brain fog, all of the things, irritability. I mean, I've met people that say, I see a change in my daughter after she eats a red lollipop or whatever, a red Skittles.
Right.
So we kind of need buy-in. And I go back to that gym analogy, you wouldn't just go to the gym, do all that hard work, lifting, running, whatever, and then come home, eat whatever you want, stay up all night, not drink enough water, drink sodas and energy drinks. And you really have to have the complete package. You really have to take care of yourself.
You have to be committed. And as a parent, you have to, and it's not going to be easy necessarily, but you have to be that accountability. You have to be the parent to your child and make those changes in the sleep and nutrition as well to complement what you're providing. Yeah, makes total sense.
Yeah. Laurie, is it fair to say that your body truly gets overloaded when you continue to obviously not eat the right foods, eat too much fast food, eat the junk, whatever, not stay well hydrated, drink sodas or whatever the case may be. And then that ends up, of course, triggering the other symptoms, the anxiety, the ADHD. I don't want people to walk away thinking, well, I can never go and have a hamburger again. What I want to hear from you is you have to be smarter about your life decisions with, don't throw the baby out with the bathwater kind of thing. I mean, you can, we can help people without saying, you got to go all the way to the other side, because I think that becomes an issue when we send people too far to either side, right?
Absolutely, yeah.
So how do you talk to people when they come in, say they were that person that came down and sat in front of the doctor with all of the terrible food? Walk them through how they have to change and make better decisions, but still feel like you're not just putting me in this little square.
You can't be in that box. We can't expect that from anyone. There's, people
because it's kind of hard to do.
Oh, it's very hard.
Obviously someone with a true substance abuse addiction has to pivot because they can't take that one drink or whatever.
Right.
But the other things, there seems like there's probably a work in progress, and how can
Mhm.
we get better without feeling like you've just got to give up everything.
Yeah. So I ask people what they drink on a regular basis, how much caffeine they take on a regular basis, like what do their meals consist of? And I talk them through how they can make changes gradually. If they say they drink 5 Diet Cokes a day, I say, can you, take one of them away and drink a glass of water, and then for a week, and then another one away, and kind of gradually ease into, you know,
Yeah.
um, replacing those chemicals, because
Yeah.
you really are doing yourself a disservice by putting those chemicals into your body. So there's colors, there's dyes, there's chemicals, there's the fake
There's no
sugars,
nutritional value
no
whatsoever other than
nutritional
they just
value
taste good.
whatsoever.
That's a great way to set the stage for someone. So
Yeah.
keep going. I love that.
Yeah, just by making the small changes, because it is hard to just say, well, you've got to just cut all this out and start from scratch. And because people aren't, there's too many people out there that are just eating
Yeah.
poorly, and they don't even realize it, that they're eating so poorly, or it can be affecting their health. The gradual changes, I talk about, eat fast food, and how we can change that. Can you make a meal at home? Can you meal prep a little bit? Have good snacks handy, the nuts and fruits and vegetables. I'm not going to change everybody, and I'm not going to be able to make people completely turn. Some people will invest and make the desired changes because they'll start to feel better.
Mm-hmm.
You are what you eat. We've been saying it for years, right?
Yeah.
You wouldn't put a can of soda in your gas tank, right? In your gas tank in your car. You only put gas in your car. So we are only supposed to put nutrients in our body. So why are we putting in all these things? Because they've made them taste really good.
Yeah, they really do.
They've made them taste really good, and they've made us want more and more. And a lot of these things are made to be almost addictive too. So sugar and additives, and unfortunately,
That is so true. Yeah.
yeah. So if
They're
you eat a
made
lot
to
of
be addictive.
sugar, if you eat a lot of sugar and you're a person that has candy every single day, try taking that away for 2 days. You're going to feel pretty bad. You're going to have to
Yeah.
get through that period of time where you just feel
It's a
like
withdrawal. They've got to get through the
it is.
withdrawal. It's the same type of withdrawal. It's a drug. It's anything that
Exactly.
you have to feel funny about as you're trying to
Yep.
get off of it is
That's right.
truly, a
Yeah.
withdrawal and some sort of addiction.
Yeah.
Hi, friends. I want to talk a little bit about Kerry from Holistic Highway, a true pioneer in integrative medicine in Ayurveda. So, Ayurveda is a 5,000-year-old system of holistic medicine that brings your mind, body, and spirit into balance. Sounds good, right? Through personalized nutrition, herbal remedies, daily rituals, and gentle detox practices, Ayurveda helps you restore harmony and lasting vitality naturally. Kerry's approach is all about you, your unique body, your story, and your path to better health. So, by weaving together nutrition, lifestyle, and genetics, which I love, she helps her clients find real, lasting balance from the inside out. It truly is the most personalized program, and I love it because wellness isn't one size fits all, it's beautifully individual. So, listen, Elevate listeners, you're invited to enjoy a complimentary 30-minute Ayurvedic consultation to uncover your personalized mind body type and one practical tip to feel more aligned and energized. So book through our show notes. Don't delay. It'll be amazing 30 minutes, totally worth it, and mention Elevate to claim your session.
We're proud to spotlight one of our valued Elevate sponsors, Brain Performance Training, founded by wellness advocate and registered nurse Laurie Sampollo. With over 2 decades in nursing, Laurie has seen the deep effects of addiction, anxiety, and PTSD on individuals and families. Her personal and professional experiences led her to introduce neurotherapy as a holistic path toward balance, healing, and restored mental wellness. At Brain Performance Training, the mission is to normalize conversations about mental health and make seeking help an act of strength, not stigma. Mention Elevate for 10% off a treatment package that includes before and after EEG and 15 neurotherapy sessions. Learn more at brainperformancetraining@gmail.com or call 843-655-3325.
You will literally feel lethargic, foggy in your brain, and you'll be craving those sweets. And If you take in the sweets again, you'll be back to feeling okay, but you'll be on the highs and the lows and the crashes. And, it's hard. It's really, really hard because it tastes good and it makes you feel good,
Yeah, in the moment.
unfortunately.
In the moment, just like a drug
In the
would
moment.
do, which is
Yes.
interesting. I love the fact that the neurotherapy, you combine it though with lifestyle changes. I mean, it just makes sense
It does.
that these two go hand in hand, and why your therapy works. And you have proof of that from your clients and the people that you're helping.
And I feel like they grow off of that. They feel good, so they want to make better decisions as they go forward. So they leave here after 5 weeks. Treatment is usually 3 times a week for 5 weeks. And then we can remap the brain and look and see how you're feeling. And if you'd like to feel like you need some more, some people feel great right away. Some people it takes a little longer. Every brain is different. Um, you know, they'll go forward and say, wow, I'm feeling really good. I might just, take a walk, or because we encourage people to take walks and enjoy nature and turn their phones off. And especially after STEM, right after a STEM session, you've got 90 minutes of like neuroplasticity, where your brain is like a child. When we say a child is like a sponge and they can absorb and learn, you've got about 90 minutes of that kind of stimulation, that kind of neuroplasticity. So we tell people to not go binge watch Netflix. We tell them not to drink or smoke. We tell them not to have caffeine. We tell them to engage in some healthy activities. If you feel tired, which you might after a brain stim, because it's kind of like a workout for your brain, you can take a nap, listen to some music, listen to a podcast, something educational, take a nice walk and enjoy nature, meditate, just avoid the things that could be toxic for your brain, which is what we kind of spoke about. The screens, the foods, the toxins, things like that, at least for 90 minutes if you can. And it just will enhance the therapy.
That's
And that
fascinating, but it also
keeps
is
happening.
perfect common sense that it would. But I didn't realize that after you have the therapy, you have that time span where really it's crucial as the decisions that you make then, because that's an opportunity for renewal, the restoring, putting the good things in that will help you go longer with making the better decisions down the road. Is that
Yes,
a great way to understand that?
absolutely. Because we're creating new pathways. We're
Yeah.
creating new
It's
neuronal
that
pathways.
river, the Amazon. You're knocking it, the brush down, and
Yep.
creating the new path.
And so when you've lived with anxiety for a long time, for example, picture a path through grass that you weren't supposed to walk through, and all of a sudden it starts to wear down, it starts to become mud. I feel like the anxiety pathways become strong, because we're living in those anxieties, right? So now our thoughts are driving the anxiety. Now all of a sudden our brain is like, oh yeah, you've trained me to be anxious. You've almost trained me to be anxious. I know I'm going to think like this now. There's something called fight or flight, the sympathetic nervous system. Your brain doesn't know if you're actually in danger or if you are just telling it you're in danger. So when you're anxious or you have a panic attack or you feel really anxious about something, your brain is like, okay, we got to click on all the cylinders. We're in flight or fight.
Yeah.
And some people stay in that. They stay in that kind of a state. And we've got to get that taken down. We've got to get maybe the vagus nerve and get that parasympathetic, the rest and digest, back in action. So a healthy person, we're lucky we have that anxiety. That's God given, so that we do know when we're in danger, and we do know when we need to run or we need to, flee or fight. So that's a great thing. That's a God given thing in our bodies. But for us to think these things and worry and put things in our heads that cause that anxiety all the time. Now our brain doesn't know, like I said, if it's real danger or not. So these pathways get stronger, and all of a sudden it becomes like your way. So we're trying to make the new pathways
I love
and
that visual.
get away from those pathways and kind of create new ones that are healthier.
And it seems like our mental health as a community has been more stressful. You've seen increase in depression, addiction, and you wonder, where is this all coming from? We have maybe breakdowns in our family dynamic, our food, screen time,
Yeah.
video games. I don't know. Do you have, Laurie, any experience? Do you have, from your experience, where do you feel some of that has contributed to where we are now?
I think it's a lot of what you said, mostly our diets. People are wanting real convenience, There's the screen time is huge because it really does mess with our brains, especially like if you look at your screen before bed. We're really not even supposed to look at screens like 2 hours before we go to bed.
Oh, wait, pause. Let's say that again. Don't look at your screen 2 hours before you go to bed. That is going to be a challenge for us
It is a huge challenge
tonight.
because we are driven by
Yeah.
these phones, unfortunately, and they're so entertaining. For some of us, we're just getting so much information. We're
And
getting
it may not all
entertainment.
be true either. And that's a problem. We're
That
getting
is a problem.
information that's not always true.
That's
And
exactly right.
unfortunately, we share it and we don't fact check it. We just believe everything that we see,
Yep.
and you can't do that.
Nope.
Fact check it. Just
Absolutely.
want
I
to put
second
that
that
out there too, which
100%.
causes us more anxiety. We become more anxious because we're seeing things that aren't true.
Because no one knows what to believe anymore. No one knows who's reporting the actual truth.
I
So it's really
know.
difficult. And it's very difficult to walk away from
Well,
it.
and everyone, and we have our phones now,
Hmm.
everyone thinks they know everything. And wherever they're
Hmm.
getting it from, they don't even know if those places are even legit. So it's
Right.
no wonder we're like this all the time.
Absolutely.
We're
Yeah.
just
Absolutely.
so heightened and so anxiety filled, and
Mhm. I
we're
think the
just,
fact
and then we
checking
get
is,
angry, and
yeah,
we see what happens. So you're
well,
right. Get off this phone.
I
Don't
know
believe everything that you
it's
read or
really
see.
hard because it does make people angry because, like what's going on in the media right now, and like people are speaking out and about, this Hollywood star and that Hollywood star. And then you see that this person said about this, and you're like, oh, I can't believe I thought he was different. And you're getting in this whole emotional roller coaster about people you've
Yeah.
never met. And now you're mad at those people. And it's just causing all of this. It's honestly, there's a God of this world, and He wants us to focus on all of that so that we don't keep our eyes on Jesus.
Yeah.
That's
That
what I'm
is
convinced
true.
about.
That is true.
That's
That's what
what
I'm
we
convinced
believe. But bottom line is that you have to start, I think, giving your mind a rest, like you're
about.
saying,
Yeah. Hmm.
and putting only good things in it as much as you can. I mean, we all want to be entertained, by shows and different things, but when it starts to impact your emotions and how you treat people, the way we are as humans, I mean, that's just, it's
Hmm.
ruining us. It's
It is.
ruining us. And so it's taking extra steps to stay above that,
Mhm.
which is why it's so important what you're doing to help people, because they're getting to the place where they are so anxious and they have
Mhm.
things. So I don't have to feel all the noise and the chaos of this world. I'm going to take a drug
Oh, yeah.
because for at least an hour, I
Right.
don't have to feel this way. So it's sad that we've got to that point, but
Mhm.
thank God you have found a way to help people, because
Yeah,
people need help.
they do. They do. And like I said, some people don't even realize how much help they need.
Well, isn't that true?
Yeah.
Isn't that
It's a fun
true?
exercise that I would love everyone to try in their spare time. Is I've learned from a person that does a diligent mind community type thing. And he said, I want you to try this on a daily basis. Sit in a chair without your phone, set your timer for 10 minutes and just stare at the wall. Just look at the wall. And you would not believe how hard it is to do that.
That would be
Because
hard
we
for
are
me.
constantly checking the phone, checking this, checking that, always stimulated, overstimulated. And it's a really good, like, come back to peace, come back to meditation. Even with meditation, our brains are just going. And you have to almost realize and say, come back and just think about your breath or whatever you're trying to think about with
Mhm.
meditation. Because we'll say, what are we doing in half an hour? What are we doing about dinner? What's happening tomorrow? What's happening next week?
Good Lord, isn't that the truth? Could I
It's the
just get through
truth.
today?
It's
Yeah.
just
A
a laundry
wonderful,
list of things
yeah.
going. It's like a little hamster wheel. Can I can I look at something other than the wall? Can I look at like nature? Can I look at, or does it
No,
Like for
just
that
have
10 minutes, you just have to look at the wall.
for that 10 minutes, you have to be uncomfortable. Uncomfortable.
That's where
Well,
we are. We need to get uncomfortable.
can I close my eyes?
Mm-mm.
I don't remember if you said you can close your eyes or not.
You can tell
I
my
probably was.
personality. I need to know exactly how to do this
I
correctly.
know. It's a really, really eye opening, no pun intended, exercise
Yeah.
because we are so used to being completely in the know, stimulated. We have the answers. I mean, I remember when we were younger, no phones, and we'd say, "Oh my God, who sings that song?" And we'd all think about it, and might not think about it till next Friday, and we'd be like, "I
Right.
thought about it. It's this one," and
Yes.
we don't have that now. We just get on the phone and we go, "Who sang blah
Yes.
blah blah?" It's there,
Yeah.
instantaneous. So we want everything
Well,
instantaneously.
that's what's ruined us. We want everything right then. It's like,
Yeah.
shutting the brain off is something that I struggle with. I go
Hmm.
to sleep and I start thinking of all the things in my head that I need to do or that's bothering me. And you have to wonder if people, generations before us, if they actually had those same struggles, or
Right.
if they did, if they were smaller, or I don't know. It just seems because of the world we live in with technology and all of that, that we could have more of those issues and things to deal with. But you know what? We used to put kids in the corner. Maybe that was why we put them in the corner when they were bad.
When they
Right.
look at the wall.
And that was uncomfortable for them, for
It was
sure. That
uncomfortable,
was uncomfortable for them to sit
right?
and do nothing and just look at a wall.
We need to put ourselves in time out.
Well, to get
Yes,
in timeout,
that's exactly right.
I was in the corner for 10 minutes.
And just look at the wall, be uncomfortable. So that's the whole idea of addiction and even craving sugar. A craving is uncomfortable.
Yes.
And so we have a cookie and we are comfortable again. But we don't, the long term effects, that's what it is. All of the inflammation in the body and the different things that are happening is just a whole, it's a cumulative. We're just seeing so much diabetes, so much, so many blood pressure issues, so many weight issues. And now there's the shots that people can take. And
Laurie, I'm curious, talking about diabetes and all of that, do your therapy as well could actually help people with those regulations as well, I would think, because you're starting to see if I can relax my brain and get things back on track, won't and I do all the other things. I'm eating better. I'm feeling
yes,
better. I'm doing so.
yes,
It's
yeah.
more. It could be a multitude of
Mhm.
issues that we're facing that your therapy could actually help us with.
Yeah, because of the whole package, because of what we talk to our patients about and changing their lifestyles a little bit at a time and realizing, wow, I could feel better if I just make these small changes. I had no idea. People don't realize it. They really don't. And it's fine. They just really don't realize soda is bad for them.
It's amazing to me, people, we don't know that by now. But I mean,
So
I know I love a Diet Coke, but I quit drinking Diet Coke many moons ago. But
Mhm.
every once in a
Yeah,
blue moon, I'll
right.
say, I'm
I know.
just craving a Diet Coke. I mean, like literally, it would, I go months and months and months and months,
Yeah.
and
Mhm.
maybe a couple times a year. But that's different than having 3 or 4 or 5 a day.
Very, very different. You're giving your body a chance to recover from it and
Yeah,
you're doing healthy things around it. It doesn't always have to be all or nothing. You can have the things that you like, but eventually you're going to start to say, I do want that, but really it's going to make me feel so bad.
that's
Is
true.
it really worth it? You
Mhm.
know? So your mindset will change a little bit here and there. It takes time. It takes work. It takes deliberate behavior. You have to be intentional. And we're not a lot of the times we're not intentional. We're just creatures of habit.
Well, we're
How did that
moving
go
too
back with your
fast.
son, with his addiction? It is for someone like him and addicts in general, my
Mhm.
understanding, you have to be, it's all or nothing. You can't go in between of
Yeah.
having something occasionally like that social drink at a wedding or whatever. How does that play into your therapy? Like, does your son continue to do any of the therapies that you do, that you offer to keep him on track?
He hasn't with us. He's been in Florida the last couple of years and just moved back about a year ago. So he hasn't had therapy with us, but he hasn't felt like he needed it either. So, we're here if he does, because sometimes folks will need a little maintenance along the way
Yeah.
or feel like, I just kind of need a tune up or
Yeah.
I'm feeling a little bit back to this or the other. But like I said, with the other therapy modalities and the tools that people get, that they can deal with the things and also taking the substance out of your life, of course, it really does help. It really does help. He can be all or nothing with other things. He does. It's even this. I'm trying to think of an example, like a skateboarding. If he's a skateboarding, he wants to go every day because it's like he loves it so much and he just wants to keep doing it every day. So it's a silly example, but I can't think of a
No,
better one.
but his
But yeah,
his personality, the way he's wired, is like that
yeah,
because
yeah,
of being an addict
right.
before.
And I think genetics do play a big role in that. So.
Lori, how can our community get a hold of you? Where can they find you? How
Well,
can
we
they
have a website. I was speaking with you about this. I have an
reach?
Instagram account. It's just my name, but I don't usually post on it. But brainperformancetraining.life is our website. And there's our phone number and our address. We're right in Myrtle Beach. Send an email, text the phone number, any questions. We're happy to talk with you. talk through the therapy itself, talk through what it entails, and see what you're needing. Of course, first responders, military, veterans will guide you in reaching out to the non-for-profit to get some of that paid for. And that's really probably the best is our website, brainperformancetraining.live.
I love that.
Well, I have one more question before I get to that, Nikki. You have anything else for Laurie? This has been such a amazing conversation.
Yes, I just want to applaud you for your efforts. And I think that your story with your son and your family resonates with so many. My family has gone through having someone who had an addiction problem, and it led to suicide. So these are real issues.
Yes, they are.
And thank God you were able to get your son on the right path, and that you are doing that for others, because what you are doing is important. It is life-changing, and it's something that people need to know about, because people in those situations feel hopeless and helpless.
Yes, they
But
do.
you are proof that there is hope and there is help. So thank you.
You're welcome. There is. Absolutely.
Laurie, what is the one simple thing we can do today to elevate our wellness journey or support someone else in elevating theirs?
I know I wrote down drink more water. I think people just don't give that enough importance.
Yeah.
I used to tell my friend, hydrate those cells. And pay attention during the day. We get busy, right? We don't drink. Pay attention to how you're feeling. Brain fog, sleepy, sluggish. If you stay hydrated, it's such an easy way to keep yourself with enough energy. Our bodies are made up a lot of water. So I just say, drink more water. Replace maybe one of your drinks during the day with some water. If you see that someone is drinking energy drinks all day, which is very popular right now. I know it's just a very simple, silly thing, but it's really important.
It's really not silly, though. It's very important. And I feel it. Yeah.
Our
I
brains
feel it
hate
when I don't have it.
dehydration. Yeah.
Yeah.
I mean, it's our orientated. We function better, and we just need water. We just need water.
Living water, right?
Yes.
That's right.
Living water.
Living water.
And adequate sleep.
And adequate sleep.
2 things.
Which
Thank
will
you
help with a lot of
so-
the things. Yeah.
Yeah. Thank you so much for being here today, Laurie.
Thank you for having me.
So
It's
good.
really important. I feel this has been a real calling for us, and I'm really happy that I am able to offer it. I mean, I'm going through a lot more classes in education to get QEEG certified, and it's a process. I'm sorry, but it's something that I feel like will definitely make a difference for some people.
Absolutely.
Well, you're definitely making a difference for our community. Thank you.
Thank you.
Hi, friends. Please leave us a 5-star review and let us know what you thought of today's episode. Share it with someone who needs a little inspiration and tell them why they should tune in to Elevate, your go-to resource for healthy living here in the Green Strand.
Each week, we're cultivating conversations that inspire well-being, support the ebb and flow of coastal living, and help elevate our community's wellness journey.
Don't forget to join our newsletter, a culinary garden of resources, including our downloadable Wellness Made Simple with curated tips from our local wellness experts. You can click on the link in show notes to subscribe.
And of course, stay connected with us on YouTube at Elevate Health Grand Strand and on Instagram and Facebook. You'll find those links in the show notes. We hope you enjoyed today's episode. The information provided in the Elevate podcast and associated materials is for general informational purposes only and is not intended as medical advice. No content should be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Reliance on any information provided by Elevate, its host, guest, or contributors is solely at your own risk. We encourage you to consult with a healthcare professional before making any significant changes to your diet, exercise, or wellness routine. Ultimately, your health and well-being are unique to you, and it's important to make informed decisions based on your individual needs.